Okay, and we actually have a patient here today that you brought in, a patient that actually had this surgery. James, if you want to come right up and tell us a little bit about why you chose to have this specific surgery.
I chose to have the surgery on the recommendation of my optometrist. He noticed that my vision would consistently deteriorate every 6 months to a year, and he'd heard of Dr. Gulani's procedure and recommended that I go and meet with him. And after our meeting, he discussed everything in detail and what the benefits were, and I was completely sold. And I said, you know, it's only going to get worse, and knowing that it's going to constantly get worse, there had to be something done.
And so describe your experience a little bit. What was the surgery like? Can you feel them? Because when I look at them, it looks like something that you'd be able to feel in your eye, and that would drive me nuts, like knowing that something was in there.
Right. I've had them for over 3 years, and I don't feel a thing. The only thing that I notice different is that when I wake up in the morning, I can actually see the alarm clock, whereas I could not before. But you don't feel them. All you notice is that your vision has improved, and you're confident that your keratoconus will not continue to progress.
And how long had you had keratoconus?
I'm not certain when it started to develop, but I understand it's a hereditary disease of the eye, and I don't think it became really severe until probably my mid to late 20s.
And that's when you really just started
That's when I noticed,
it just kept getting worse.
It's starting
and worse
to get
and worse.
progressively worse every year or so.
Had it gotten to the point where you were just fed up with it, that, you know, like my glasses, I've told Dr. Gulani before, they're pretty thick.
Well, and that's exactly what happened. And you know, you notice that, okay, well, you know, my wife, hers stays pretty much the same all the time. Mine continuously gets worse, and it gets worse, and it gets worse. Not dramatically so, but progressively so. And there had to be some sort of solution out there somewhere, and I trusted my optometrist, and he made the recommendation. And as I said, once I met with Dr. Gulani, he explained it in detail, in layman's terms, so that I could understand fully of what I was going to be getting into, what kind of results I could expect. And he didn't make any grandiose promises that he did not come through with. Extremely happy with what the results are.
Recovery, what was that like?
Well, out of it kind of the first day or so, but the recovery, as soon as everything wears off, as far as you know, whatever the slight anesthesia was or whatever, you're in good shape, and you can start seeing right away. And it was, for me, a very, very good experience.
So you notice an immediate change after the surgery. I mean, we've talked about this before with LASIK and all the different other surgeries. Everyone seems to notice pretty much immediately afterwards a change. Was it the same for you, or did it take a little bit?
Well, it just took for the medications to wear off.
Okay.
Well, once those wore off, I think I woke up the second day, and like I said, I just noticed what time it was, and I hadn't put on my glasses yet.
I'm jealous, because there's no way. My alarm clock is right there, and I have to literally like lean over, or else ask my husband, what time is it?
And you just notice changes slightly. It's like all of a sudden I notice I'm nearsighted, but bad nearsightedness. And I notice, okay, if I'm reading, I got to take my glasses off. I have to. And that was a pleasant benefit of the surgery.
That's wonderful. Well, thank you so much for joining us. I appreciate it. And Dr. Gulani,